Hello, 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 everybody. Welcome, welcome, welcome. Today, our guest is LaVarne Burton, President and Chief Executive Officer of the American Kidney Fund, a national nonprofit organization whose mission is to fight kidney disease and help people live healthier lives. Ms. Burton has led the AKF since 2005, working very hard on behalf of the 3.5 million Americans living with kidney disease and the millions more at risk, seeing to it that the AKF presents an absolutely unmatched scope of programs that support people wherever they are in their fight against kidney disease, from prevention through transplant, with programs that address early detection, disease management, financial assistance, clinical research, innovation, and advocacy. No kidney organization on earth directly impacts more people than the American Kidney Fund. Since 2023, under Ms. Burton's tutelage, nearly 60,000 low-income people on dialysis and living with kidney transplants nationwide were able to pay for insurance premiums, have emergency pandemic related costs covered, not otherwise covered by insurance, all thanks to financial assistance grants from the AKF. Millions of people benefit annually from the AKF's efforts to fight kidney disease through the organization's numerous education campaigns about living with chronic kidney disease and its comorbidities. During her time as CEO and president of the AKF, the organization has become one of the most trusted charitable organizations in the United States. The AKF is included in the Consumer Reports list of the best charities for your donations and has received the Charity Navigator's highest four-star ratings, get this, for 21 consecutive years. The Charity Navigator's rating system evaluates nonprofits for their financial health, accountability, and transparency and impact. The AKF is also listed on America's top 100 charities by Forbes. Please give a warm welcome to our friend, LaVarne Burton, President and CEO of the American Kidney Fund. LaVarne, how are you today?
Good morning, Jim. I am doing very well, and thank you so much for giving us this opportunity to talk about kidney disease and people who are living with kidney disease. I am very appreciative of the opportunity and the opportunity to just speak with your audience.
Wonderful. Did I state everything correctly in the introduction?
You absolutely did. I think on the number there of people who have kidney disease, you might have stumbled a little bit on that point. It's actually 35 million people who have kidney disease. And quite frankly, the vast majority of them do not even know it. So we've got you and I and everybody else who's involved with this disease. We've got a tremendous challenge. But I know that you keep working at it every day, and we at the American Kidney Fund are here to support you and to also work at it every day. Let me add on one other factor. Kidney disease is actually the fastest growing non-contagious disease in this country. So, it is something that really commands our attention and focus to do more about it.
Okay, thank you. Please tell us a little bit about where you grew up, your education, and your employment experiences.
Okay, thanks a lot, Jim. I was born and grew up in Georgia, in Augusta, Georgia. So I'm from the deep South. I went to public schools in Augusta through high school. And I then came to Washington, D.C., where I did my undergraduate work at Howard University and my graduate work at George Washington University. I spent quite a bit of time working in the public health service around health service programs. And then I went to Capitol Hill, where I stayed for quite a while. I worked on Capitol Hill for the House Budget Committee for about 15 years and got, that much deeper into health policy issues. When I left the Hill, I became a political appointee in the Clinton administration. I was the Deputy Assistant Secretary for Budget and then the Executive Secretary to the Department of Health and Human Services during the Clinton administration. After that time, I left the government and went into the nonprofit sector. For several years, I was the president of the Pharmaceutical Care Management Association. Many of you may know that there are PBMs, Pharmacy Benefit Managers, and that is their trade association. After leaving there, I did some consulting. I was a partner in a consulting firm for a while and worked on Medicare issues during that period again. So you'll see Medicare going in and out of my career. And then finally in 2005, I say finally because this is where I landed at that point in my career and have been since 2005 the president and chief executive officer of the American Kidney Fund. And I'd like to tell people that I think I have been extremely fortunate as a career in that I have had opportunities to learn, to grow, and to contribute to developing public policy, primarily health policy in this country. And I am tremendously grateful for the opportunities that I've been given to do that. But I think the American Kidney Fund to me really represents the pinnacle. The opportunity to interact with patients, to really be there for people who are challenged by a very serious disease and to be able to provide support for them, not only financial support, and we'll talk about that later, we do a lot of financial support, but there for them to listen, to understand their issues, to advocate on behalf of them at every level of government, as well as with our various partners in the sector, and to get to know patients such as yourself and to understand the struggle that you're dealing with, really dealing with so courageously. And as you are now doing this podcast, giving back, trying to help others to understand the issue, if possible, trying to help other people understand what they can do if they or family members are impacted by kidney disease, or if they're at high risk for kidney disease, so that they can do something to either hopefully prevent it altogether or to better manage it if they have kidney disease. So it's just been a wonderful opportunity to work with patients. I have a tremendous staff at the American Kidney Fund. I couldn't ask for a better staff, and I know you've worked with them a lot and that you would agree with me. And we have so many supporters, including many of the people in your audience who support us in so many different ways, coming out to our events, going on our website, using our materials to educate other people, making financial contributions to the American Kidney Fund, and just being there for patients and for us. So I start this morning from a position of great gratitude.
Wonderful. As president and CEO of the AKF, how would you describe your duties and responsibilities?
That's a really interesting question. My responsibility really, I think, starts with I want to use the word listening. I have a lot of different interests that converge, starting with the patient interest and those who are around patients and support them. We have and that's really foremost, listening to the community of those who are involved in providing kidney care, listening to my staff. That's a really important part of my role, is listening and being at the center of all of those voices and helping to frame a vision for the American Kidney Fund and what we can do on behalf of patients. We revisit our strategic plan on a fairly regular basis, and we are very we're very specifically goal oriented. My role in this is, with all of that listening, is to help define and guide those voices into a strategic direction that comes back to our mission that will help people live better lives as they deal with kidney disease. So my role is making sure that I'm pulling together all of those voices and taking all of that input and striking a strategic vision that moves us forward in terms of how we can support people who are dealing with kidney disease.
Excellent. Let's talk about some of the programs, the AKF programs that affect so many kidney patient lives. Let's start with what when I started with you was originally called the Charitable Premium Assistance Program, what I think now is called HIP, or the Health Insurance Premium Program. Can you tell us a little bit about that?
Sure, I'd be happy to. Our health insurance premium program, of course, is our largest program, and it allows us to do so much on behalf of patients. It is in the government divides how you do things and how you spend your money into various categories. And so from that perspective, we are a charity, of course, and we provide charitable premium assistance to patients. We probably assist some pay premiums for about 60,000 patients in the past year. And what we do with that program, let me back up a minute and talk about the financial condition that people who are in kidney failure, where they often find themselves. I know you know this, and many of you in your audience will know that if you are in kidney failure, there are two options for you. If you're fortunate enough to be able to get a transplant, and if you're not, then you go on dialysis. The chances of getting a transplant, quite frankly, are not that great. There are 90,000 people on the wait list. Only about 25,000 transplants are performed a year. So more than likely, you're going to join the over 500,000 people who are on dialysis. And when that happens, you have to go in for your dialysis treatment, where your blood is removed from your body, cleansed, and then restored. And that occurs about 3 times a week for about 3 or 4 hours, very often leaving a person feeling deplenished. Makes it very difficult to hold down a full-time job. Some people are able to, but most folks, quite frankly, are not. As many as 80% of people who are on dialysis are unable to work full time. So that means not only are you dealing with a serious health issue, but you're dealing with a very serious economic issue. Many of the people who are in kidney failure many of them are older people, but many of them are young people at the peak of their earnings, with not only themselves to take care of, but with family responsibilities as well. So the economic issues for someone who is in kidney failure are considerable. And that's why I say that what we do is really so important and so gratifying, that we're able to step in and say to a person, you've got to have health insurance, because there's no way for you to fight this disease unless you can get health care. And so we're able to step in and say to a person, tell us what health insurance you're eligible for, whether that's Medicare or private health insurance or employment-related insurance or Medigap. And we are able to provide assistance, and we pay the premiums for you. And we do that. We did that last year for some 60,000 people. Over the course of the time that we've operated the program, we've assisted probably 2 million people in paying their health insurance premiums. So that's what that program is all about. We have a couple of other financial assistance programs. People sometimes need some assistance with the out-of-pocket cost of their medications, or they need assistance with money for transportation to their medical appointments. We can help with that through our safety net grant. People are eligible for safety net grant once a year. Then the third way in which we provide financial assistance is that people are sometimes struck with natural disasters, as has happened in Houston a little bit earlier in the summer. And we're able to provide grants to people to help them with emergency needs, whether that is emergency housing or food or clothing or replacing medications. We're also able to provide those grants. And one of the things I want to say to your audience is that whenever you hear of a natural disaster and you start seeing charities that are requesting funds to help with that natural disaster, you will see American Kidney Fund out there as one of those funds. And so when you are looking at how to help people in a natural disaster, please consider contributing to the American Kidney Fund. Of the monies that we take in when around natural disasters, every penny of that, we don't take anything off for overhead or any of that. All of that money goes directly out to patients. And I'll give you an example. At the beginning of the COVID pandemic, we were all terrified of what comes next. But even as we and as my staff and I looked at the fact that we needed to go remote because of all the questions that were coming up, and all of the uncertainty around it, the very week that we went out remote, we started a new program, our Coronavirus Emergency Fund. And we raised very quickly more than $3 million. Every single penny of what we raised went to patients to help them deal with the emergency. We knew, we were at a time in this country when food banks were shutting down, when everybody was trying to stay home. But you have to remember that people who are on dialysis or people who have transplants and need medical attention, they can't decide to shelter in place. They have to go for that care, or their life can very well end. They need assistance with medications and with the transportation. They not only need assistance with transportation, but we were at a point especially during the early days of the pandemic, before there was a vaccine, where you couldn't afford, if you were very vulnerable, to get on a public bus or to share any kind of a public ride. And so not only did you have to meet the cost of transportation, but your cost of transportation went up because you had to ride privately. And so we were able to provide assistance to people to help them meet their needs. I think we were able to assist almost 15,000 people to meet their needs during that period. So those are some of the kinds of things: paying premium assistance, helping people in the case of natural disasters, and providing a safety net to help with out-of-pocket costs that your insurance won't cover. Those are some of the kinds of things that we do from a financial perspective. But we also know, Jim, that finances are not the only things that challenge patients. When you're dealing with a disease that is as complicated, that is so ever present, it's always with you. You wake up in the morning knowing that I've got to take steps to deal effectively with this disease. We provide education programs, both for patients as well as for professionals in dealing with disease. We also provide materials that community leaders can use to educate others about how to deal with this disease. We provide support for patients. We have a number of patient groups going on. Overall, we have about 30,000 patient ambassadors who work with AKF. And we give them the opportunity through private Facebook pages, through meetings, both at the local level and in DC, to get to know each other and to have access to our staff and to our materials to help them better manage the diseases that they're dealing with. So those are just that's some of our programs, and I can talk about a few more. We have a lot of activity going on, and however you want to proceed on that.
Right. I wanted to ask you about the clinical scientist and nephrology program. Can you talk to us a little bit about that?
Yes, I'd be happy to talk with you about that. The clinical science and nephrology program is one where we award a couple of fellowships every year to people who are interested in doing clinical research around kidney disease. These are people who've completed their basic medical education, doctors who've completed their basic medical education, and who want to go on and they want to focus on how to better improve care and how to better understand the issues around kidney disease. And very often they will also go into graduate study for masters in public health or other related areas. And they will take on a research project. And they will do that research project over the course of 2 years under the tutelage of a professor at their medical school. We are tremendously proud of the fact that many of the leaders in nephrology in this country have started their research careers through fellowships that were provided by the American Kidney Fund.
Okay. You talked to us already a little bit about the AKF advocacy network and the things that your advocates do. Is there anything you'd like to add to that?
Sure. The advocacy program is really, I think, one of our great successes. We've got about 30,000 people who volunteer to be the voices for themselves and for others as well who are dealing with kidney disease. And the goal of that is we want to make sure that people understand the lives of people and the challenges of people who are dealing with kidney disease and the successes of people who are dealing with kidney disease and how they're contributing back to the community. So we've got about 30,000 advocates, known as, we call them AKF ambassadors. One of the things that we do is that we bring them to Washington, D.C. once or twice a year. We take them to Capitol Hill to talk with their senators and congresspeople and the staffs of those people. We want them to talk about what does it mean to live with kidney disease. We want to make this illness real, and we want to relate it to real people. We don't want it to just be, well, 30,000 is a great number. Each one of those persons has an individual story, and we want to share those stories. So part of being an advocate is that you agree that you want to share your story with policymakers, with the media, and with the public, because understanding who a person is and what they're dealing with builds support and empathy around that, so that when we come to policy advocacy, when we are trying to get a particular rule passed or legislation passed, it's not just a piece of paper, it's a real person, and connecting how that legislation or that rule or that general policy impacts a real individual, impacts their family, and also impacts the community and the congressional district or the state district of those people who are making decisions. So at the bottom of all of it is the goal that we will put a face on kidney disease, that people won't just be looking at words on a piece of paper, but they will be looking at real human lives, and that people will understand that but for the grace of God, there go I. That any of us can be impacted by kidney disease. And I was at a conference yesterday, and I was on a panel, and the moderator started off by asking who in the audience had a family member or a friend or just knew somebody who was on dialysis. I think every single hand went up. This is a very prevalent disease. As I mentioned at the beginning, this is one of the fastest growing diseases. It is the fastest growing non-contagious disease in this country. It is the 8th leading cause of death in this country. We have got to take it seriously. We've got to really marshal the resources to fight it, which is what the American Kidney Fund does. But we invite others to join us in doing that.
Wonderful. Talk to us a little bit about the AKF's Health Equity Initiative. What is that all about?
Okay. Be very happy to talk with you about our Health Equity Initiative, Kidney Care for All. When you look at kidney disease and who's impacted, we all are potentially impacted. 37 million people with the disease, and it can affect anybody from any background, racial, economic, otherwise. It's pervasive. But as you see people move from having kidney disease to being in kidney failure, there is a disproportionate impact on people of color. African Americans are 13% of our national population, but 30% of the people who are in kidney failure. The rates of kidney failure among people of Hispanic descent, among Native Americans, Asian Americans are, 1.5 to 2 times more than white Americans. As a leader and an advocate for patients, one of the things I said is we have to listen to patients. We have to listen to all patients. And we really have to go where this problem is. And a lot of the problem of dealing with kidney failure is among people of color. And this AKF has always been in the space of dealing with health equity because of the people who are impacted by the disease. We started an effort in 2021 to really call this out, to focus and elevate it as an issue of concern, not only for the American Kidney Fund, but for our nation. And that's what our Health Equity Initiative is all about. Making sure that before anyone takes action, that we understand the problem, we understand where it exists, and that even as we serve all people affected by kidney disease, that we look for some of the root causes, that we look for where the problem exists and what relates to that problem. We know that there are a number of issues, for example, among the African American community, that high blood pressure and diabetes, which are two of the major causes of kidney disease and kidney failure, are very prevalent. We know that there are social drivers of health, from housing to food deserts in many communities, those kinds of issues, which again impact people's health. We want to call those things out. If we're going to solve a problem, we have to identify that problem, and we have to put in place a plan to address that problem. So for our Health Equity Initiative, we've identified 4 facets. One is early prevention, detection, diagnosis, and management of the disease, so that people are more likely to be aware of the risk and to seek treatment and to learn early on whether they have the disease or are at high risk for the disease, and what do they look for to understand their risk, and then get themselves in care and carefully manage the disease. Because while you can't reverse kidney disease, you can slow it down. Kidney failure is not inevitable in most instances. And then another part of it is that as we look at modalities of treatment, from home dialysis to transplantation, we know also that that there are gaps in the use of home dialysis, that there are gaps in access to transplantation. So we're trying to do what we can, both by ourselves and working with others, to address those issues. And then in the 4th facet of that effort is clinical trials. We want to make sure that people who are impacted by the disease are represented in clinical trials. And so we work to inform our population, our patients, and those that work with AKF about clinical trials, to understand overall what they are about, to understand where there are specific clinical trials, and to give them some guidelines so that they can make a decision on whether or not they want to be included in a clinical trial. And then on the other hand, we work with pharmaceutical companies to understand what they are doing and to share that information. So it's a both two-way street in terms of trying to make sure that people who are going to be the users of new therapies that are developed are included in the clinical trials, so that when the results are available, those results will relate to those people, and you don't have to be guessing about how a particular therapy, how a particular drug is going to impact a given segment of our population, because those folks have already been included in the trials. So that's what we're trying to do. We're trying to raise the visibility of the issue. We're trying to make sure that people get into care early, trying to make sure that people understand home dialysis and whether and have the opportunity to consider whether it's appropriate for them, that they understand the transplant process and how to get on that, and that we increase the number of people of color who are able to get transplants, that they're included in clinical trials. And then another issue that is dealt with, and this kind of feeds into another one of our initiatives. As we have worked on these issues, you're always learning new things and moving into new territories. And as we have worked on these issues, one of the things that we have also begun to deal with is the whole issue of rare kidney disease. And we know that rare kidney diseases do sometimes very often have a genetic basis. And some of that genetic basis, again, goes back to perhaps some racial or racial differences. And so we're focusing on how do we elevate awareness around rare diseases. And we have a project called Unknown Causes of Kidney Disease that kind of captures that area of work. I will tell you that, and that also has several facets. One is understanding, elevating the importance of this area. The other is developing a policy platform to get legislation, regulations, access to things like genetic testing that patients need. And we work with other charitable organizations as well in terms of that genetic link, and trying to get more support for genetic testing so that people can understand not only if they have a particular disease or a propensity for a particular disease, but if it is genetic, are there other family members, particularly family members who may not yet have the disease, that should be tested so that they understand what their risks are, and in many cases they can do something about those risks. We also have patient groups as part of that effort, both to inform patient groups about what this effort is all about, as well as to get information from them on their experiences. And then we have professional groups. It's really important when you're talking about rare kidney diseases that we not only include in our professional groups the nephrologists, the kidney specialists. It's really important that we go downstream and include primary care doctors. Because when people present for these conditions where there is a suspicion of something or something's going on in your family that you're trying to get to the bottom of, is usually your primary care physician or your primary care provider where you start. And if primary care providers are more alert to the possibilities of what they should be looking for, then it enhances the opportunity to refer people early, for the specialist care or for the genetic care that they might need.
Excellent. Excellent. I just want to take a moment to remind our audience that if you go to my Facebook page, this broadcast is going to be pinned to the top of my Facebook page. If you go to the comments on the broadcast, all the things we're talking about, all the links are there. So if you want to access any of the things that we're speaking about today, you can go to my Facebook page, the broadcast pinned to the top of my Facebook page, and in the comments, if you're interested in something and you're trying to find it, that would be the quickest way to find it. Or you can go to Google and just type in, AKF in a particular topic, and it will come up. They have a very, very good website that's recently been updated, and it's just banging. They do a great job. So if you're looking for more information, you want to drill down on something, you can find it there. Let's talk about something that's near and dear to my heart, the AKF's National Virtual Camp Program for Children. Can you talk to us a little bit about that?
Well, I share the your excitement around our virtual camp program. About a couple years before the pandemic, so that would take us back to around 2018. We started a partnership with the Pediatric Nephrology Center at Johns Hopkins University. They had a camp already, and it was an overnight camp that allowed children who have kidney disease to go to have the camping experience. And as you know, many of these children are not able to go to regular camps just because of their conditions. So we started working with them, and we had a grant from the Shafter Foundation, which is in the DC metropolitan area. And we were able to go out to their camps, provide them with supplies, provide them with things like iPads and backpacks with various kinds of camping supplies. And we really so much enjoyed. I mean, that's the kind of activity, and you probably see a smile on my face because you can't talk about this without smiling. And that's the kind of activity that is just so invigorating for us, really. It just makes it really brings home why we do what we do. But along came the pandemic in 2019. And of course, these kids couldn't go to an overnight camp, and they couldn't even come together for sessions. And we said, we can't just walk away from these kids. We have to find another way of doing it. So we decided to start a virtual camp. So what's a virtual camp? A virtual camp is we schedule activities online several times a month, and we will focus on a particular kind of activity. For example, over the over the Christmas holidays, over the holidays, we did gingerbread houses. And what we do is we sent out the gingerbread kits to each child who is a part of our camper program so that they had everything that they needed. And because many of these kids may have siblings in the house who may not have kidney disease, but you send something to one kid, and what about my little brother or sister? So we sent for the number of kids in the house. We have sent iPads to all of the kids so that, of course, they can connect to us. And then sometimes we just have drawing, or we just play games, or we just talk. But and the kids voluntarily share their contact information with other kids. So it gives them their own forum so that they can come together and get to know each other, get to know another child who's dealing with the same disease. There are some less than 10,000 kids in this country who are dealing with kidney disease, kidney failure. And, you know, they don't necessarily know each other. And they and their families have opportunities to develop support systems because they do get to know each other. And so we started with the Johns Hopkins group of doing these activities several times a month. And then as time went on, other pediatric hospitals found that we were doing this and asked, can we join the program? And so I think last time I counted, I think we had about a dozen pediatric centers from across the country, because the advantage of doing it virtually, of course, is that we're not limited geographically. We are always limited financially because there are certain materials, supplies, devices that we want to send each kid who's in the program so that they're able to fully participate. But we have our staff who lead these efforts, board members from the American Kidney Fund who come on. I came on and did the gingerbread house back in, I think, December. And it was a fun thing to do.
Okay. Let's talk a little bit about some of the new stuff that's going on. The American Kidney Fund's new APOL1 mediated kidney disease campaign. Can you tell us a little bit about that? I think that's unique to your group, is it not?
It is unique, and this has been an effort that is so important and also very enlightening. APOL1 mediated kidney disease, AMKD for short, is actually something, a factor in kidney disease that was discovered through NIH-supported research in the last decade. And the bottom line of this is that APOL, AMKD, is caused by a gene variant, a variant in the APOL1 gene. And this variant greatly increases the possibility that a person will develop not only kidney disease, but that it will quickly move to kidney failure. The gene itself, the variation of the gene is prevalent in people of recent Western and Central African ancestry. Over time, over many years, hundreds of years, the gene variant developed because of African sleeping disease. And it helped people to not have African sleeping disease, which was a condition that was very prevalent in those parts of Africa, and that resulted in death. A person just went to sleep and never woke up. As that variant developed, however, it caused an increased propensity to kidney disease. And there are about, I believe the number is about 13% of the population of the United States has that gene variant. If you have the variant, there are two genes, and if you have the variant in both genes, then it greatly increases the possibility that you will develop the disease. And what happens is that it may profess as a different kidney disease. For example, FSGS. We did a lot of work with Alonzo Mourning, the basketball star, when we were rolling out this campaign. Some of you who are real basketball fans may recall that a couple of decades ago, it's been that long, Alonzo was at the peak of his basketball career. He was participating in the Olympics. I mean, the picture of health. And he became ill. And when he came back from the Olympics and started seeing his doctors to try to understand what was going on, he was eventually told that he had a kidney disease that was going to lead to his kidney failure and that it was progressing very rapidly. Alonzo was very fortunate, and that kidney disease that he had was FSGS. And he was very fortunate in that a relative stepped forward and donated a kidney so that he got a transplant and never went on dialysis. Fast forward 20 years or so, 15 years. And this AMKD is discovered. And working with his doctor, he decided to do the testing, and he found out that he had this gene variant, and that it was the gene variant that caused his FSGS, or his kidney failure. And the thing about AMKD is that not only does it increase the possibility that you're going to get kidney failure, but your kidney failure progresses much more rapidly than a person, let's say, who has diabetic kidney disease. So there currently is no direct treatment. There are some treatments that are in trials for AMKD. But one of the things that you can do is, number one, make people aware of it. And so this past spring, we rolled out a campaign, awareness campaign around AMKD to begin to talk about what is it, who's most likely to be affected, and what you can do about it. And while there is no direct treatment at the current time, and we hope that there soon will be, there are some things that you can do about it. For one thing, you can, as always, seek care to understand your kidney function and be tested and determine whether or not, you are healthy in that way, or whether you have some stage of kidney disease. You can also look around, your family, because there is a familial kind of relationship. Is kidney disease something that's prevalent? And if you have it, or if you feel that you're a high risk, then you want to work with your medical care professionals to do the things and their lifestyle kinds of things around diet and exercise. And there are some new medications as well that will help you to manage so that you don't hopefully end up in kidney failure. And so we're really excited about this opportunity, just to talk about this, the new discoveries, the new innovations. We're excited about the new therapies that are developed, and very much we want to encourage additional investments in government research as well as private sector research in developing new therapies for all stages, whether it's for downstream prevention and early, detection and treatment, or upstream for improving care to those who already may have some advanced stage of kidney disease or even kidney failure. These are things that, that again, why do we do them? It's because we have patients dealing with kidney disease who are impacted by them. And so we want to make sure that wherever our patient population is, that we're going there and that we're helping them deal with that. So this is another really exciting opportunity for us to work on. And again, this is a genetically based disease. It falls under our umbrella of unknown causes. And so, as we look at these new opportunities to explore together with patients, what is the status? What are the needs? What are the directions that we can go? It opens opportunities like this for us to deal with things that really mean a lot to patients.
Okay. I wanted to ask you about something that just took place this week between the 11th and 15th of September, the Congressional Black Caucus Foundation's annual conference on the issue of equity in kidney transplantation. Can you tell us a little bit about your experience with that?
Yes. In fact, just yesterday, I participated on a panel at the conference. And the purpose of that panel was, there were a couple purposes: to talk about kidney disease, because this is a conference that it's sponsored by the Congressional Black Caucus. There are some 60 members of the CBC, the Congressional Black Caucus, and they're from all over the country. Like other members of Congress, they represent the constituents in their districts, and many of the constituents in their district are in fact African Americans. They're people of color, and so that's the focus, and they focus on almost every aspect of life impacting these people. One of the sessions yesterday was on kidney disease, and it was a great opportunity for us to participate in that session to talk about why is kidney disease and kidney failure in particular so prevalent in the African American community. And we focused on that, and we focused on a specific issue around how Medicare pays for new and innovative drugs, and concerns about how that can affect, certainly how it can affect the African American community of people who are dealing with kidney disease. But it really is how it affects all people who are dealing with kidney failure. And so there are a number of reasons, and I've talked about some of those. I've talked about the lack sometimes of early diagnosis and treatment so that people can get preventive care or get care at the early stages. I've talked about some of the environmental challenges that we kind of categorize as social drivers of health: housing situations and food situations and economic situations that make it difficult for people to get care. The prevalence of high blood pressure and diabetes among this population. And then the fact that we, as African Americans, also have genetic issues of concern. And so that was part of what we talked about, because those four things really help to explain why it is that kidney failure is so prevalent. And they identify some things at a very high level. We've got to, over time, drill down into those things to better understand them, which means we've got to do more research and develop ways of dealing with them. So definitely that conversation is very much at a beginning stage. The other thing that we talked about as part of that conference, though, is that, the vast majority of people who are in kidney failure receive some kind of Medicare assistance. And so Medicare largely controls the kind of care to which they have access. And so when a Medicare rule comes out that affects kidney patients, it's really, really important. And there is a proposed rule that came out last summer that will be finalized by the end of the year. And under that rule, there are certain medications that people now get through mail service pharmacy or drugstore that would instead move to the dialysis bundle. And that really is of concern because, as you know, Jim, that the dialysis services are already under a great deal of financial pressure. And that financial pressure affects the quality of care that people will get. So if you add to an already volatile, a highly pressurized situation, if you add another responsibility in that bundle, our concern is that it could very well have an adverse effect on patient care. If you add certain drugs, and we categorize those drugs that we were talking about as oral only drugs, if you add those to the bundle, what happens to the quality of care in the center? What happens to patient access to the drugs that they and their doctor have decided are best for them? Or as part of the bundle, will there be a limitation on the drugs that are available? Will they be able to access? The doctor says you need one drug. Will that drug be covered in the bundle? Or will the patient have to switch to another? Will the patient have to do step therapy to fail on a drug before they can get to the one that their doctor recommends? All of these are issues that affect patient care. And we want to make sure that those people who are affected, and in fact, those people, in this case, the Congress, who can do something about these issues, that we bring these issues to their attention. And that's what yesterday's discussion was all about.
Okay. One more thing I want to ask you about that's been interesting for me. I just started a group called Kidneys and Obesity, and part of my inspiration was the Obesity Care Action Network from the AKF. Can you tell us a little bit about that?
Okay. Well, we're working with other groups, really, with regard to one of the things that's happened, as everybody in this country knows, is that over the last several years, we've really had a lot of advances in drugs that will help deal with obesity, that will help deal with diabetes and early stage kidney disease. We're not medical professionals. I certainly am not a medical professional. And I never want to even imply that a person should take one drug or another. What we want to do is clear out the noise. We want to make sure that those new innovative drugs that are developed are available when doctors working with patients decide that they are the best therapy for their patient to help them deal with some of the underlying causes and conditions that not only lead to kidney disease and kidney failure, but that can adversely affect outcomes. How do you address those? And if there, to the extent that there are new therapies that are available, given the seriousness of this disease, kidney failure is life-threatening. Given the impact on families, particularly, young families at the peak of their earnings, all of a sudden not able to work, tethered to a dialysis chair, given the impact on their family budgets and the impact on our national economy. I mean, this is kidney disease, kidney failure is one of the most expensive situations, diseases to deal with. For all of those reasons, if there are things that can help people to address the disease, the underlying causes, we want to make sure that doctors and patients have the opportunity to consider and determine whether a particular drug is the appropriate drug for that patient. So that's why we are involved in this effort.
Okay. Please talk to us about how the organization has become one of the most trusted charitable organizations in the United States. I mentioned some numbers during the course of my introduction, and 21 straight years of a top rating. I mean, how did you do that?
You asked me at the beginning of our discussion, how did I see my role? And I said, part of how I see my role is really, I need to be a listener. You can't lead without listening. And as part of that listening is that you have to give a response. And I think that response is all around transparency. It's all around accountability. We at the American Kidney Fund are always true to our mission, and we are accountable to our patients for whom we advocate, to our supporters, to our partners, and also, especially coming from me, to our staff. I think that looking at those things, making sure that you're on target with regard to mission, that you're accountable and transparent with regard to how you are marshaling and using resources to accomplish that mission, and readily sharing that information, and being disciplined about how you go toward those goals and how you use those resources, and having that information readily available to all of these organizations that do those review. And I'm grateful for a tremendously accomplished staff and skilled staff who make sure that we do all of those things. We have one single goal: helping people with kidney disease live healthier lives. And all of our resources are marshaled toward that. And we make sure, in terms of all the rules of how you operate in this nonprofit world, that we are complying with those, and that we share that information, that we are transparent in terms of how we share that information. And let me add our board, which is a very important partner, and the role that the board plays in overseeing all that we do. And so we are, have so many, our network of people who are involved with accomplishing our mission. We are so grateful for everything that they do. They make these kinds of reviews possible.
Okay. I want to ask you about the AKF's policy priorities for 2024. And first, I want to ask, how is it that you go about determining what these policy priorities will be? I know we've talked about many of them already, but what I'm curious is, how do you pick and choose what gets emphasized and what does not?
Yeah. It goes back to the same answer, Jim. We are listening to what is meaningful for patients. We're listening to what's going on in our environment that may either help patients or in some cases may put certain things at risk for patients. We're listening to partners. We're trying to make sure that we are in the moment in terms of understanding what are priority issues. And we develop, again, based upon our strategic plan. We identify areas where we want to focus in a given year. We have the great advantage of a board that's very engaged with us. And so those things are shared and board policy committees as we determine what are our priorities. And we're always true to our strategic plan. We spent several years developing the strategic plan that's now in effect together with our board. And so there's a thread that goes through what we do. As we understand one issue, you will see that as I've talked, I moved from rare diseases to equity issues to specific rare diseases. All of those things really come together. They're not separate, activities. There are relationships. And so as we look at priorities, we have an effort, for example, called Know Your Kidneys. Part of what, as we talked through and worked through some issues related to our rare kidney diseases and our unknown causes of kidney disease effort, we realized that, our Know Your Kidneys project is really, the thread needs to come so that, great, step one is knowing your kidneys. But step two is you got to know what's causing it. You cannot assume, as for so long, the assumption has been, well, you have kidney disease, you're in kidney failure, so it must be diabetes or high blood pressure. In the vast majority of cases, that's probably true. But we know that as many as 15% of the people who are in kidney failure have causes other than high blood pressure and diabetes. And that can affect the way that you're treated. So you not only have to know your kidneys, you got to know your cause, and then you have to come up with a plan of what you're going to do. So that is a major effort for us going forward, and you can see how it has evolved. One of the other things, again, going back to our environment, is that we want to take advantage of others in sharing their experiences. One of the things that we started doing this summer, and we will ratchet up actually this fall, is our partnership with Suni Lee, the Olympic gymnastics champion. Suni, as you probably know, has two rare kidney conditions, and she has been willing to, to share her experiences. She very fortunately was able to do something that she herself and most folks who were working with her early on after her diagnosis didn't think that she could do, which is to return to be a gymnast. And she not only returned, but she went to the Olympics and performed well and brought home other medals this summer. We're going to be doing work with her around her experience to share that as part of our unknown causes effort. We're also going to be sharing information, about genetic testing and counseling and clinical trials. And we're going to continue our efforts to build more support in those areas. We are going to continue our efforts with regard to living donor protections, both at the state level and the federal level. This is something that we've been working on for several years. We even produced a living organ donor report card where we grade all states in terms of what kinds of protections they have for people who are living donors. And we work with states on legislation and policies to support living donors. As a result of our efforts, the first report card that we released gave states an average grade of D. They're up to a C now. That's not where, as great as we want to get, but it is improvement, and we continue to work with various states to try to move that upward. We will continue to expand our patient advocacy network. It is so important that the patient voice is heard, and we want to continue to both give patients a platform as well as training. Of course, we will also continue our efforts with regard to our health equity efforts, our unknown causes efforts, and we will continue our efforts to make sure that our patient voices and our voices are heard at all government levels. Last year, we sent some 25,000 action alerts to members of Congress. We did more than 500 visits with state and federal officials to talk about kidney issues. Those are things that we will continue as well. Just next week coming up, we have a conference on summit on unknown causes of kidney disease. This will be our second in-person summit, and we held these virtually beginning in 2020. We also will be bringing patients to town as part of that, and we will take them to Capitol Hill to talk about the whole issue of kidney disease and unknown causes and rare causes, and the relationship to genetics. We also have a couple of conferences coming up this fall. We have the Hope Affair, where we will, shine a spotlight on patients who have kidney disease and how well they are not only dealing with their disease, but reaching out to help others. And so this is a night to honor those patients. It has come to be called informally to be called we just so much enjoy it that it's just a wonderful night for patients, and it's come to be informally called the Oscars for kidney patients. And then we have the Patient Access Initiative Summit, which we'll also have this fall, where we identify these issues that are particularly challenging from a legislative and policy perspective, and to continue to build support for how we focus on those. So we've got a lot of work coming up.
Excellent. Excellent. You're making my job real easy.
Well, we're always happy to do that.
Do you have any final statements that you would like to make to our audience?
I think that my final statement to the audience would be, I think everyone who is part of this patient community, that we really have to focus on making sure that people who make decisions about how you work with patients, how you support patients, how you deal with kidney disease, that they really understand what is kidney disease, who are the human beings, the people and families that are impacted, how their decisions, the decisions of policymakers, affect access to care, quality of care. We really, I think, have to continue to work to build a supportive and empathetic audience, that people understand that kidney disease is a real threat to families. It's a real economic threat to the nation, and that we must do something about it, and that we cannot be content to look at yesterday's or even today's therapies and approaches to dealing with it, that we've got to continue to push that we need to, devote the resources and the time that we need to make improvements, that we cannot accept that, well, kidney disease is always here. Our vision, we talked about our mission, but the vision of the American Kidney Fund is a world without kidney disease. We have to work on that step by step by step. And if we don't work on it, we're never going to get to it. And it's a tremendous, tremendous goal. But we have to start by working on it by awareness, by identification of the issues, and by a plan to address those issues, devoting the resources to carry out that plan.
Wow. Just a wonderful job that you've done on the broadcast today. It's such a great raising of awareness and education for all of us about yourself and about the American Kidney Fund. I want you to know how much I appreciate you coming on with me and giving us the opportunity to learn from you all of your experiences and the things that are going on with the AKF. Totally brilliant. I'm very, very appreciative.
Okay. And thank you so much, Jim. Thank you for the broadcast. Thank you for your support of the American Kidney Fund. And most of all, thanks to you for sharing your own experiences as a kidney patient and for reaching out to so many others.
Not a problem at all. I'm very proud to do it. One of these days, I want you to ask me when we're at one of the national meetings that my story about why I became involved with the American Kidney Fund.
That's where I will certainly do that.
Okay. I know I promised you I'd only keep you an hour. We've gone about 10 minutes over. I have a few things to button up with my audience. I'm going to let you go because I know you're a busy person. But I just wanted to say what a wonderful job that you did today, and I'm so appreciative.
Okay, thank you, and thanks to your audience for listening. You take
All
care.
right, you have a good day. We'll talk soon.
You too. Bye-bye.
Bye-bye. All right, everybody, that's our broadcast for today. As you know, I'll be sharing the replay. So if you missed it this morning, that's okay. You can catch it at my normal time on Friday night or anytime after today. Next week, we're talking to Dr. Tessa Novick and Michelle Osuna from the University of Texas about caring for people with kidney disease who come from marginalized populations, things like, how difficulty with finances or difficulty with housing can make kidney disease even more difficult than it normally is. So a little bit about disparity in healthcare next week. I appreciate everybody's patience. I hope that you like what we're doing, and I want to thank you for watching. Please share the broadcast around. Let's make sure everybody gets an opportunity to hear the wonderful things that Ms. Burton said today. So I thank you for watching. I will see you next week. You have a good week, my friends.